Dr. Lou, I would like to talk about, gum disease, periodontal disease, as it is called. Now, and I have a very heavy question here. Almost every dentist will tell the patient that gum disease, the biggest problem because of it is that eventually you will lose all your teeth. And while this is with no doubt a bad thing, one thing is also sure, that you dentists really, you make wonderful implants, and we even have talked how kind of a denture, which is implant supported, I called it a hybrid, works well. So basically we're not living 100 years ago or something like where George Washington apparently, I don't know, did have a wooden tooth. That must have been awfully awkward. But you guys making good teeth which feel pretty much like the original teeth. So losing the tooth rather than paying money is not the worst thing, which not that it's a good thing, but it can at least be replaced. But here is what I see. While you have this gum disease, 1 year, 5 years, whatever it takes to lose your teeth, during that time, you have a disease, you have an infection in your mouth. It's at the gateway of the blood vessel, and it drips slowly into your blood on a minute-by-minute basis. It ruins your kidney, it ruins your liver, it brings down your immune system, it can and will and has created heart attacks and strokes. Pregnant ladies have had newborn babies which are underweight, premature, name it. I mean, to me, it looks like that stuff is much more worse than losing the teeth, because at least with money you can replace them. How do you replace your liver, your kidney, and a poisoned immune system and all that stuff? Shed some light on it and tell me how far off am I here? I mean, am I totally misinterpreting this situation?
You are so correct, dear Helmut. It's true that all the bacteria, everything that's in your mouth is linked to your body. And you're correct. All these articles, medical journals that you stated about pregnant women, if the pregnant woman does have a lot of bacteria or some periodontal disease, believe it or not, it does get transformed to the newborn fetus. And they've had shown studies that if you have periodontal disease or if you have a lot of bacteria in your mouth, it has been linked to possibly heart attack or stroke. So a lot of what's in your mouth is also linked to the rest of your body. It's your health of your mouth is also tells the health of your body too. So you are so right, and it's a very grave situation that some people are not aware of.
Yeah, it looks like to me it looks like that dentists and especially NDs are just not making the patients enough aware of it, and even the dentists on an average, because, as I said, they keep saying, you lose your teeth, and well, fine, that's like 5-6 years down the road, but like how badly you're hurting the body. I have talked to dentists who swear that people with a healthy gum simply live longer, have less illnesses, which makes sense because, there's a study in Japan which said that people who have the HIV virus contract the AIDS, convert it to AIDS much more easy than people who have no gum disease, if they have gum disease, which is why, because the immune system is down. Well, if it can be doing something so drastic, thanks God most people don't have HIV virus in the first place, but if it can do something so drastic, it can get babies born, in fact in California we had one baby born stillborn because they found the buzz of the gum disease in the placenta. Very rare situation, but if you can't do that, what about the everyday flu, the swine flu, the bird flu? Never mind the swine flu, the bird flu, just the normal flu season, which comes, 4 times a year these days? You see what I'm saying? I mean,
yes.
The fatigue, they're slowly ruining your liver, because an infection by definition travels. It infects other parts. So I think much more emphasis should be made to let to the people, about that, because maybe they become more energetic, less sick on a daily basis, the sniffle and the weakness and stuff, if they're told more.
That's correct. And here at our practice here, we definitely instill that in the patients. If we see any problems or any infections in the mouth or in the x-rays, we tell the patient right away, and we come up with a treatment plan to resolve it, to take care of it, so they can be healthy in the mouth and in the body. And like you said, it's a situation where some patients don't know because they don't feel anything. But like you said, they may be tired, they don't know what that's due to. But believe it or not, it can be due to all the bacterial infections in the mouth.
Right. Now, you said about, you go and you do a treatment plan. It's just a very short question. We're running out of time here.
Sure.
At any stage, because there is, there's very light gum disease, which is still an infection traveling in there, right? Because people, if they have a little yellow pus which doesn't go away on their hand, on their toe, within a few days, a few weeks at least, they would run to a doctor and get it fixed, right?
Yes, that's totally correct. And these infections, some of them you don't feel anything, but they're there for a long time. And if it doesn't, unfortunately, a lot of patients, if it doesn't bother them, they don't do anything about it until it's too late, and it gets bigger or it's painful, right. And then you may even.
They think that a little bit of bleeding when flossing is kind of, it's all right, no big deal, just a little bit. But they wouldn't act like that if their finger every day bleeds a little bit, would they?
No, they wouldn't. It's something that they can see in the mouth. They try, they figured, that's just, they
right.
deal with it, unfortunately.
Right, but back to my question fast. Sorry, me who sidetracked you now, but can, at any given stage, little gum disease or a lot's gum disease, can it be fixed like in a rather fast way? Like bang, you go in, you cut it out, or you do laser treatment, whatever it is, but it can be taken away and stopped. Yes or no?
Yes, it can if it's done and the patient is very compliant. It can be done. Yes.
Well, by very compliant, but you can take it away without the patient's compliant, as long as he comes to you and gets it taken away. Then in order to not get it again, he needs to be compliant, right?
That is correct, yes.
Okay, but it can first be taken away, that's for sure.
Yes.
Good. Thank you very much. Thank you very much.
So
I hope this video wakes a few people up. In fact, maybe we should just stop this whole interview here and get my butt to a dentist. To make sure I don't have any gum disease. Let's clear myself. All right.
Thank you so much.
Bye-bye, Dr. Liu.